Sewell.
Thank you, Chairman Buchanan and Ranking Member Doggett. I want to thank all of our witnesses today. Today is the 13th anniversary of the Affordable Care Act, and thanks to the Affordable Care Act, millions of Americans are able to afford health coverage that was completely out of reach before its passage 13 years ago. I have testimony for the record from over 30 patient groups, including ALS Association, the American Cancer Society, the American Diabetes Association, to name a few, stating the importance of the expanded healthcare coverage that the ACA provided to more than 120 million people with pre-existing conditions. And I'd like, for the record, Mr. Chairman, to include it in the record. My constituents in Alabama are disproportionately impacted by chronic health conditions, including diabetes, heart disease, and cancer. Sonia, a constituent of mine from Montgomery, Alabama, wrote to me about her father, who had been denied coverage prior to the enactment of the Affordable Care Act's pre-existing conditions protection due to his cancer diagnosis. Sonia wrote that her family prayed that it would stay in place because of the security that this protection offered her and her family. For millions of low-wage workers, the ACA expanded access and affordability through Medicaid expansion, making this one of the most transformational policies of our time. Uninsured rates in expansion states plummeted in the years following the ACA's implementation. Medicaid expansion has helped patients access preventive care like cancer screenings, increase access to transplants, and made diabetes medication more affordable. Unfortunately, millions of Americans have experienced none of these gains simply because of where they live. You see, my state, the state of Alabama, has not expanded Medicaid. And when I think about the many hospitals that have closed in the rural parts of my district, I was not surprised, although I was shocked, that 85% in the last 10 years of rural hospitals that have been closed in states that did not expand Medicaid. The Affordable Care Act is the law of the land. I believe in this great country that no person should not be able to have affordable access to affordable and quality health care. I believe that it should be a right. The fact that we are the last of the industrialized countries in the world to not have universal health care as a part of our DNA, it really does sadden me. And it saddens me because we get caught up in names and titles. I think about my constituent, Hank. And Hank is a farmer a fifth-generation farmer, and had farmed all his life. And his dad farmed and his grandfather farmed. He was a third-generation farmer who never was able to afford health care. In 2014, a navigator named Doug visited Hank on his farm to get him and his family enrolled in the Affordable Care Act. And even though Hank wasn't a supporter of President Obama, he signed up for a Blue Cross plan that cost him only $100 a month, thanks to the premium tax credits and cost-sharing reductions. The following summer, Hank was working on his farm when his hand got caught in his hay baler. When he tried to pull his right hand out, his left hand got stuck as well. The family's plan, which they had had for less than a year, covered the emergency air flight and his hospital bill. Hank was able to avoid a financial catastrophe, like so many Americans experience who are uninsured. Clearly, Hank's story serves as an example of how the Affordable Care Act does protect millions of Americans from devastating medical debt. The sad part about it, and Hank admitted to me, when the navigator knocked on his door, he said, "Do you want to have health care insurance, affordable health care insurance?" He didn't say, "Do you want to be enrolled in Obamacare?" And Hank admitted to me, had he said, "Do you want to be enrolled in Obamacare?" he probably would not have had this life-saving insurance that literally saved his family from catastrophe. Mr. Chairman, I hope that we can put politics aside and really think about what's in the best interest of all the people. I'm talking specifically to my state. I really hope that they will take an opportunity to expand Medicaid so that more and more people can get insured. In fact, for the 2022 coverage, over 200,000 Alabamians enrolled in the exchange. Just how many more would have also enrolled had we expanded Medicaid? Thanks.